Take a guess as to why you are walking into A&E. How many of you thought because of a nosebleed? Yet, nosebleeds, or medically known as epistaxis, is one of the most common ear, nose and throat emergencies that present itself to the emergency room and account for 0.5% of all emergency department visits.
Good effective first aid should stop 90 to 95% of all nosebleeds. A mistake a lot of people do, they're not applying the pressure in the correct area, and also a lot of people don't apply pressure for long enough. They might apply for 2 or 3 minutes and then it gets quite tiring having your arm up like that. Most effective treatment is pinching the nostrils for 15 to 20 minutes with sufficient force. This can easily be done at home, although many people, I think, kind of panic. You see a lot of blood coming out, they don't keep pressure in the right area, they're not keeping pressure on for long enough.
There is no data on the percentage of people who experience recurrent nosebleeds. However, we all know someone who suffers from this problem. Nosebleeds can occur at any time or place without warning, leaving the person unprepared and in an unpleasant situation. 100% of people surveyed rated their nosebleeds as severely disrupting.
They can be very disruptive, especially depends where I am. Like if I'm in bed and it happens, I can kind of hold up on it. Like there's nothing worse than blood dropping onto your clothes or onto furniture or anything that stains.
It's the most distracting thing in the world. Your priority instantly goes to your nose, and even when you see blood you panic instantly just because you don't know sometimes.
It's very disrupting because a lot of time it happens during the middle of the night, so you'd wake up and all your pillows be covered in blood, and then obviously the fear of how much blood did you lose.
45% of people were left in a dangerous scenario due to their nosebleed.
It's a bit overwhelming because your focus comes off the road and onto your nose then, because you need to contain the blood, because if you ignore the blood you could pass out because of loss of blood, and then that would make an even worse situation. So usually you just try pull over as quick as you can.
I probably would just have to put on the hazard lights if I was driving and pull into the side of the road. It definitely could be a big problem.
And 100% of people surveyed said that a nosebleed has resulted in an embarrassing situation.
Meeting people, sometimes it's embarrassing when it just goes off out of nowhere. It's kind of awkward when you have to rush off and clog your nose up and then come back and try act normal.
If there was a device that we could use or could be widely available at home that put pressure in the correct area for long enough, kind of took it out of the patient's hands